Dr. Swank, just to start off, could you give us a capsule summary of what multiple sclerosis is?
Well, it's a disease which involves primarily the central nervous system, that is the brain and spinal cord. And clinically, it is characterized by periodic attacks in which some neurological symptom develops, then stabilizes, and then followed by what we call a remission. In other words, the condition gets better. Sometimes it gets very much better so that the patient considers that he's completely recovered. Other time he only gets partially recovered from the attack. But these attacks keep on recurring periodically, on average about one per year per patient over the long haul, and they can involve any part of the nervous system involved. There could be blindness, for example, of one eye, double vision, for example. There can be numbness and tingling of extremities, or weakness of a leg, or stiffness of a leg. There can also be a lot of incoordination, so that the hands will shake violently, or even the body and the head will shake violently. And then, of course, dizziness is a common enough symptom. These symptoms come with varying intensity and then disappear. And as the disease progresses over a period of years, the patient gradually becomes disabled and finds that he can no longer walk, or he has great difficulty walking, and finally may come to a wheelchair and then continue, of course, to slowly deteriorate.
Do you know of any effective treatments to stop multiple sclerosis?
Yes, I believe so. We use a low-fat diet in the treatment of these patients. We've been using it now since 1948, and we have a series of patients, 150 patients, which we have followed for going on to 40 years now, and which was reported at the end of 34 years of treatment. And these patients who were started early enough on treatment before they were disabled have done exceedingly well, and most of them have avoided disability.
Now, you've just explained to us the benefits of a good diet and a good lifestyle in multiple sclerosis. These are simple things that patients can do for themselves. I want to know about treatments that doctors give patients, like medications. Are those effective?
Well, no, I don't believe so. There's been a great deal of prednisone and other other steroid treatments used, and ACTH, the material which stimulates the production of corticosteroids. These have been used, and they do, on occasion, give some benefit short term, but in the long-term treatment of the disease, they are useless. And also, they are apt to produce a lot of nervous tension, which sometimes is counterproductive in these patients.
Now, in practical terms, what have you seen happen to multiple sclerosis patients that accept this low-fat diet?
In practical terms, they do very well. If you can make the diagnosis early and get them on diet early, they do exceedingly well. And our statistics in the group of 150 patients which we treated over a period of 40 years, and which we reported at the end of 34 years, is that 95% of the early cases, those who are not disabled, who followed diet carefully, 95% of them were ambulant and quite active at the end of that period.
And how does this compare with patients who do not follow a low-fat diet?
Well, at the end of that period, 90% of them approximately were dead.
And those patients who maintain a low-fat diet can expect to remain at the same activity level?
95% of them were essentially the same. There was a factor of aging coming in here because they were now approaching 70 years of age, and they weren't quite as active as they were when we placed them on the diet, but they still they were no more disabled than the average person at that age.
How strictly do you have to follow this low-fat diet?
That is the problem. The problem is that the patient has to follow it strictly and steadily. Now, there's an interesting thing that happens here that I think we should bring out. That is, if the patient doesn't follow the diet strictly, in other words, he's 10 grams or 20 grams over the diet, he will not have an increase in exacerbations. He'll go along just the same way without an exacerbation, and we'll get the idea that he can eat that much fat without getting into trouble. But actually, what happens is he soon starts going downhill rapidly, and once that starts, it's very difficult to stop.
What kind of dietary regime do you work out for people who come to see you with MS?
We've worked this out pretty carefully and have published it in book form. It's a diet which contains less than 15 grams of fat, of animal fat, and we have substituted, we've not insisted, but we have recommended that the patients eat somewhere around 15 to 20 grams of oil, that is a vegetable type oil, and it contains about 60 to 80 grams of protein, and the rest carbohydrates, as much as a patient needs in order to keep up their energy and to meet the requirements of their job in life.